Thank you for joining us today for Racial Disparities and COVID-19, the link to nutrition. I am Jeannie Blankenship, Vice President of Policy Initiatives and Advocacy at the Academy of Nutrition and Dietetics. I'm joined today by Richard Boykin, the President of Bridge Builders Consulting, and Kristen Gradney, a registered dietitian nutritionist and spokesperson for the Academy. The Academy is the world's largest organization of nutrition and dietetics professionals, representing over 107,000 credentialed practitioners. We are thrilled to offer this presentation following our Nutrition and Health Equity Summit last month with the Congressional Black Caucus Health Brain Trust. Our session today will include an overview of racial disparities and COVID-19 provided by Richard. Following his presentation, we will begin a conversation with both Richard and Kristen that explores the role of food, nutrition, and health status, which has left many vulnerable to COVID-19. We will discuss the challenges and opportunities for members of the Baptist Convention to help bridge the needs of their communities and parishioners. Richard, I will turn the microphone over to you.
Thank you very much, Jeannie. First, I want to express my sincere congratulations to Reverend Dr. Jerry Young and the leadership team at the National Baptist Convention USA on your virtual convention. I also want to congratulate all of those who are attending this important session and gathering of the Baptist Convention. Ida B. Wells once said that the way to right wrongs is to turn the light of truth upon them. And that is exactly what we're doing today. Racial disparities and COVID-19. COVID-19 has unmasked the deep disinvestment in African American communities and historical structural racism associated with redlining, poverty, and other social policies that caused food deserts and exacerbated health disparities. African Americans remain the least healthy ethnic group in the United States of America. Next slide. Now what we see here is racial disparity trends from states, cities, and COVID-19. The trends are alarming, to say the least, in terms of its disproportionate impact on African Americans in particular. In the state of Mississippi, African Americans make up 38% of the population and 72% of the deaths related to COVID-19. African Americans also account for 56% of new infections in the state of Mississippi. In Louisiana, we see a similar trend. African Americans make up 33% of the population and 70% of the deaths related to COVID-19. In my state of Illinois, in the city of Chicago, African Americans make up 30% of the population in the city and 70% of the deaths. We see the same trends in many of the other large urban areas where we have large populations of African Americans in Milwaukee, Michigan, and others. Next slide, please. In this slide, we see confirmed COVID-19 cases in African Americans by U.S. counties. As you can see, the trend line goes up and it continues to go up. And so we have a lot of work to do. Next slide, please. In the next slide, we see deaths from COVID-19 by U.S. counties. And that trend line, of course, is up as well. Next slide. Racial disparities begin at birth. African Americans have the highest infant mortality rate of any racial or ethnic group in the United States of America. African American infants are more than twice as likely to die at birth as white infants, a wider gap than is estimated to have existed in 1850 during slavery. Disparities in maternal and infant mortality are rooted in racism, structural racism in healthcare and social service delivery means that African American women often receive poor quality care than white women. African Americans have the highest incidence of mortality rates of colorectal cancer of any ethnic group in the United States. And I added that slide because of the Black Panther, Chad Boseman, who just died from colorectal cancer. And so obviously we have a lot of work to do in this area. The next slide talks about racial disparities in healthcare, a call to action. The social determinants and health inequalities, poverty, incarceration, racial discrimination, violence, environmental exposures, lack of access to healthcare and housing. All of these influence morbidity, heart disease, stroke, diabetes, cancer, injuries, mental illness, liver disease, and infant mortality. Many of the risk factors associated with these social determinants of health include poor nutrition, physical inactivity, obesity, high blood pressure, tobacco smoking, substance abuse. The call to action is simple. I mean, obviously, the Baptist Convention has a major role to play in terms of a strategic partnership, initiatives to make sure that the parishioners, the people that you come in encounter with every Sunday and during the week at Bible study, that these individuals are safe and free from COVID and free from other pandemics that will follow COVID-19. So really the call to action is that everybody stay engaged and that we figure out how do we have these strategic partnerships, like with the Academy of Nutrition and Dietetics. How do we make sure that everybody has health services? How do we make sure that we have policies that actually address the main issues that exist in our communities? How do we make sure that people have access to quality health care? And how do we make sure that we have a workforce that actually reflects the great diversity of the states and of our nation? A workforce that actually engages with communities and that values communities. And so with that being said, I'm pleased to turn this back over to Jeannie Blankenship, and thank you for the opportunity to be a part of this important conversation.
Richard, thank you so much. We really appreciate your going over those high-level statistics, and I think you pointed to it at the beginning, but it really is troubling and alarming to see some of the disparities. And in particular, I was just taken aback by the slide and seeing the same story in state after state and large city after large city. So what that tells me is that, you know, when you see one statistics, you can write it off as being, well, that's an abnormality, but we're seeing this over and over again. So clearly, as you noted, we have work to do. I'm really proud to welcome Kristen here today. Kristen comes to us from Louisiana, one of the states that Richard mentioned. So Kristen, you're in one of the hot spots for COVID-19. You've seen firsthand the challenges that communities are facing when it comes to food security and access. Tell us about how these challenges in New Orleans and Louisiana are playing out.
Thank you all for having me. It's a wonderful opportunity to be able to discuss these disparities. And, you know, specifically in Louisiana, most of our major cities are predominantly African American. New Orleans is 60% African American. Baton Rouge is about 50%. And we have continued to see disparities. So these are disparities that existed before, but are exacerbated now. We have higher unemployment rates than the average, which means that we have higher food insecurity. We have higher incidence of chronic disease. So our communities are really struggling right now amidst, you know, the pandemic of racial disparity, but also COVID-19 and now being affected by hurricanes as well.
Yeah, the hits just keep coming. Richard, I think I know the answer to this, but would you say that you're seeing similar conditions in Chicago?
There's absolutely no question about it. And the reality of it is that in Chicago, what we see is decades of disinvestment in these minority communities, especially in the African American community. And so on the south and west sides of Chicago, what you have is you have a significant number of areas that are deemed food deserts, which means there are no real grocery stores. I mean, they depend on corner stores. There are no real fruits and vegetables, fresh fruits and vegetables. I mean, in fact, guns are easier to get access to than fresh fruits and vegetables on the south and west sides of Chicago. And so we have a lot of work to do to make sure that we deal with the structural inequities that exist on the south and west sides of Chicago, to make sure that those communities are whole and to make sure that people have an opportunity to actually experience what we call the American dream. And so also access to healthcare is a major issue. So you have a lot of people who are uninsured, who, may for no fault of their own, they just fall within the gap where, I mean, they work a job, but they don't have insurance from that job and they don't qualify for Medicaid. And so quite frankly, they're left behind. So we got poverty issues on top of the food deserts. You got housing issues where you have confined housing and multiple people on top of each other. And in this virus pandemic, of course, social distancing is important. And so how can you social distance if you have so many people in one household?
Great. Thank you for sharing that with us. I think you're spot on when it comes to the access to healthcare. And unfortunately, the economic situation right now will only make that worse over time. So it is definitely something that also we need to monitor and track and to continue to watch the trends. Kristen, we know that many members of our communities were already facing food insecurity before COVID-19, and that these members rely on programs such as the Supplemental Nutrition Assistance Program, or SNAP, school food programs, and senior nutrition programs that would include home delivered meals and congregate meal sites. How have these programs adjusted during the pandemic to address the increased need that might be there?
Sure. So we have seen these programs grow and adapt and pivot along with COVID. In many situations, what we learned is that we had third-party nonprofits, or we had nonprofits step up and really meet the need by doing grab and go, as opposed to serving a summer food meal program where kids came and had to sit down and eat the meal before they left. So many things in our world have changed, but so many organizations have really stepped up to the plate and met the need. In addition to that, we see that now more families are qualifying for SNAP. Whether that is a good thing in the pandemic, it also shows us again that so many families were on the brink of being in poverty, that 1 week or 2 weeks of no pay has now put them into a new category, and they are really struggling, not only to feed themselves, to feed them families, to stay housed. So it shows how fragile our system is and how fragile the lives of all of these working Americans have been. We're also seeing that while more people need SNAP, we need more funding for SNAP. There's an ask out there right now to increase that funding by 15%, and it's stalled. So we have families who are getting funding, but still not enough, still struggling to meet it, still struggling to find healthy, adequate food that they can access that will meet the need of their entire family. So while we've had some great initiatives, we've had some great movement, we still have work to be done to really improve the health of our communities through not only food access, but then being able to provide healthy enough food to meet the nutritional needs of our community, who are also suffering from chronic disease disproportionately. So there are so many different factors to be considered while we're talking about food insecurity, the existing, the response to COVID, and then how do we continue on from COVID?
Yeah, absolutely. And I think in Richard's introductory slides, he talked about the fact that much of that disparity starts at birth and then continues along the life course. Kristen, you and I have previously talked about food dignity and how that impacts an individual's decision to participate in these assistance programs. What is food dignity, and how can Baptist Convention members best navigate its challenges?
So when we think about people in situations where you're having to come to a food bank, you're having to ask for food and you may have never had to do that before, or this is something that you've consistently had to do. When we think of those environments, they're often not welcoming. You're often standing in a line. It doesn't feel dignified. And when we think about the basic definition of dignity, it's a human right that everyone has food. So we need to treat these situations as though every human has the opportunity, the right to have food. And when we present that, that we do it in a dignified way. We don't have people standing in a line. We don't hand it to them in a brown paper bag and have them move along. And I think faith-based communities have historically done this well, have opened up their doors, have opened up their homes, so to speak, to offer people to come in and feed them in a way that feels like it's more family as opposed to I'm giving you a handout. So continuing to do that in a way that recognizes that people are just in need of a human right, a God-given right, then I think that we can do a better job of making going to a food bank, going to a food pantry, feel like it's a dignified act, just as if we would be going to the doctor for health care or asking for water. It's all a dignified act that we all deserve the right to.
You know, that's really striking and moving. And I just think of how powerful it is when we do come together as a community, and just the power of families and groups breaking bread together, and what that means and what that symbolizes, that this is an opportunity to continue that and to frame this perhaps in a different way than we're used to seeing it in the media, or sometimes represented through even feeding assistance programs. Richard, can you share examples of how you've seen this issue addressed in the communities where you live?
Well, I want to tell you, I applaud Kristen, because let me tell you, she's exactly right about faith-based institutions and the fact that, look, every major civil rights movement, every major progress that's been made for African Americans in the United States of America has gone through the church. And so, quite frankly, it is the faith-based institutions who will, in fact, partner with food pantries, partner with food banks, and make sure that people are fed, make sure that that they're clothed, make sure that their other needs are being met. Quite frankly, here in Chicago, we have a number of faith-based churches that are partnering with FQHC's federally qualified health centers to make sure that people are getting testing, to make sure that their medical needs are being met during this pandemic. And so we've also seen the piece where faith-based institutions are actually providing meals to seniors, providing meals to people who can't access food. And so this is being happen. This is occurring in Chicago, but it's also occurring, I'm sure, across the country. And that's why I say to the National Baptist Convention USA, now is the time for the church to really stand up and to stand in the gap and make sure that the needs of those who need food, who need water, who need clothing, who need access to health care, make sure that those needs are being met, because we're going to face significant challenges down the line. And it's not just COVID-19, it's other issues that Kristen and Eugenie talk about so eloquently.
Well, that's a perfect lead in, because our next question shifts our focus slightly and relays to what you just mentioned there at the end. We've heard that COVID-19 has impacted those with chronic diseases such as diabetes, heart disease, obesity, and kidney disease at greater levels and with more dire consequences. Richard, your data suggested that communities of color are already impacted by these nutrition-related diseases. Can you tell us how the pandemic has brought to light the inequities in access to nutrition care and services, Kristen?
Sure. So, we have seen with the doors closing of many clinics where people can no longer physically walk into a clinic and be seen by their provider and, have to shift to telehealth, that has really been jarring to our community alone. Many of our brothers and sisters don't have access to Wi-Fi, cell phones, the technology required to really continue their healthcare seamlessly. So we have struggled with that in our community and really have had great partners who are making sure that our patients are still being cared for, because we know that those same people who don't have that access are the people who are most affected by not having it. So how do we close that gap and be able to shift so that telehealth, along with healthcare in general, is accessible to every single person? Whether that's pop-ups where we're offering iPads and people can come into a station and see their provider, give them that same feeling with a safety. We have to be creative with our solutions. Additionally, dietitians, being able to offer medical nutrition therapy through these same methods is really important. We know that many of these chronic diseases are affected by the foods that you eat every day. And being able to offer that service to all of our Americans is really important. So looking at expanding Medicaid to make sure that registered dietitians and medical nutrition therapy are covered during this pandemic is more important than ever. We've talked about food insecurity and not being able to access all the foods that you may need to consume just for your nourishment, but in addition to that, to be able to really care for yourself appropriately, and having a registered dietitian like ourselves be out there who can help navigate through some of that. And some of the solutions that are out there, there's the M&T Act of 2020, so medical nutrition therapy, and also just state advocacy, as I mentioned before, advocating for the expansion of Medicaid so that all of the services that we should all have as a right, which includes nutrition counseling by a registered dietitian, should be accessible. I can't stress it enough. Our community is disproportionately affected by diabetes, hypertension, chronic kidney disease, all which are significantly affected by the foods that you eat, the diet that you have, and the access to food and care.
Thank you so much, Kristen. Richard, we also have been working on an initiative to increase the diversity in the workforce through support for HBCUs and minority serving institutions. Can you just touch on your role and why you see that as being an important link to the discussion that we're having today?
Yeah, but I want to put the pin in the point where Kristen made in terms of diabetes, high blood pressure, obesity, all of these things. All of these things are preventable. These things are preventable. People may say they're hereditary, but let me tell you, you can break the cycle. It's all in what you eat. I mean, you are what you eat. That's what we grow up and we learn that. And that's true to a certain extent. But if you have the services of a registered dietitian or you have the services of a nutritionist, you will not have to worry about, as long as you follow their advice, these other chronic diseases. I mean, that could lead to your death. And so everybody ought to want to enjoy quality of life. And it also takes the burden and the strain off our healthcare system in terms of the overload that we see from these chronic diseases. But in terms of this initiative, what we want to do is we want to make sure that we got a workforce that represents America, a workforce in terms of registered dietitians in communities like New Orleans, Mississippi, Chicago, Milwaukee, where they have people who look like them who are registered dietitians who can actually understand and relate what it's like to grow up in the inner city, what it's like to eat ham hocks or fried chicken and all that. I mean, some of this stuff is not bad for you. I mean, it's all in the way you prepare it, right? How do you prepare this stuff so that you can get the nutritional value out of it? Obviously at churches, people like to serve fried chicken after church and stuff like that, and cake and peach cobbler. But you ought to have a registered dietitian who can help you, so that you can have a congregation that's going to not grow waste-wise, but grow in terms of their wisdom, in terms of their knowledge of how to eat right. And so that's why you got to have this registered dietitian. But we're proud to work with the historically Black colleges and universities, the predominantly Black serving institutions, the Native Americans, the Asian American schools, and Hispanic serving institutions, so that we can increase the number of registered dietitians who are African American in particular and Latino.
Thank you, Richard. So last question, I appreciate both of you giving your responses to that previous question. What are the opportunities for faith-based organizations to help with food security and access to medical nutrition therapy? How can we position our members, these members of our churches and communities, for future threats such as COVID so that we don't find ourselves in this predicament again? Kristen?
Sure. So, as Richard mentioned, we have always turned to our faith-based communities when we were in need of change. And right now, we are in need of change on so many fronts, particularly around our health and our care, and taking advantage of where we are, but also taking back the opportunity to speak up for ourselves and say, here's what we need. So primarily, looking at our communities and saying, what is it that we need now? And I think what we need now is, a welcoming place to be able to come and get the services that we need. We need food, obviously, because there's so much food insecurity. We need nutrition education. And we need just a welcoming place to come and feel safe and be able to come and ask for those things and feel dignified when we do it. So, to do that, that's partnering with your local Department of Health and helping to bridge some gaps. I know here locally, our food bank brings a mobile market to many of our churches, and we'll do a market on site where people feel comfortable coming, and it's almost fellowship as opposed to I'm going to stand in line for a service. So engaging and saying, how can we open up our doors to allow that spirit of fellowship to help people move through food insecurity and also health? Including a registered dietitian in any of your education, any of your messages, any of your offerings, community. I know my church does, plenty of fun things for our families, for our kids, have a registered dietitian be able to come and share some information in, again, a setting where it's trusted. We have obviously a gap in healthcare providers who look like the community that we serve. So giving an opportunity for people to get information in a safe and comfortable setting where there's trust is huge right now. So being able to do that, I think, is the first step and really an important step.
Excellent, Kristen. I really appreciate that advice. And I love the idea of meeting people where they're at and considering it to be part of that fellowship. Really, I think those are the types of solutions that are most welcomed by individuals across the U.S. Well, thank you both for this discussion. I know our listeners appreciate the information and will contact you for further details. I'm going to pull up a slide that we have with my contact information and just recommend that if anyone would like to speak with Richard or Kristen via email, please send me a quick note. I will make sure that they get it. This is my email here at the bottom, jblankenship@eatright.org. Again, jblankenship@eatright.org. Thank you so much. We look forward to the continued dialogue. Best of luck with your convention.